So I want to talk about this report that just came out. More older women becoming first-time moms amid U.S. fertility rate declines. For the first time in 2023, there were more births among women over 40 than there were to teenage girls, according to a government report. And this is the government report from the NVSS if anybody wants to go take a look. So demographers are trying to discern why some people or more people are choosing to become pregnant later and give birth later. Most births now occur to those ages 30 to 34, while a decade ago, the cohort that was most likely to give birth were those ages 25 to 29. From 1990 to 2023, the fertility rate for women aged 35 to 39 increased 71%, and for those aged 40 to 44, the rate has increased 127%. Researchers say that a number of possible explanations for the gradual increase in the age of new mothers include evolving social expectations and values, changes in technology and dating behavior, the economic burden of child rearing at younger ages, and increasing college enrollment amongst these individuals. I am one of those people who delayed childbearing until after age 40. After 5 cycles of IVF were unsuccessful, I did use an egg donor to become pregnant with my twins, and that was still complicated as well. It wasn't a straightforward process. I ultimately ended up having a complicated pregnancy where I was in the hospital for 2 months and I delivered prematurely and had twins in the NICU at 31 weeks. So people are delaying childbearing until after age 40 for a number of reasons. For me, it was my training and education, and I just didn't find the right person until after I was age 40. But they also are requiring the need of the advancements in assisted reproductive technology. So this increase in births after age 40 does not mean they were spontaneously conceived. A lot of these people are using IVF, and like myself, even donor eggs to become pregnant. And that is something that needs to be acknowledged and discussed. So seeing these stats should not falsely reassure you that you could delay childbearing until after age 40 and not even think about your fertility, because the reality is you very well may need help if you delay childbearing until after age 40. If you are planning on delaying childbearing until after age 35 and even after age 40, I highly recommend that you see a reproductive endocrinology and infertility specialist just to get to have that baseline discussion about your fertility and anything you can do proactively while delaying your childbearing, and to just get a baseline assessment. I highly recommend that. I also highly recommend that you educate yourself on the potential complications, not only of conceiving after age 40, but of complications in pregnancy and birth. I will do a part 2 and we'll talk about that. So I recently published a video about a new report that came out saying that the birth rates in individuals over age 40 have now surpassed the birth rates in teenagers, which is never happened before. I'm going to tag that video here, but now I want to discuss some things to consider when potentially getting pregnant after age 40. I wrote this paper a couple of years ago with a couple of my residents. Pregnancy after 40, recommendations for counseling, evaluation, and management from preconception to delivery. This is a pretty comprehensive review, and you can access that in my link in bio if you go to my link tree under Babies After 35 resources. I have a Dropbox of articles. This is a table on the recommendations for preconception workup, meaning things that you should do before becoming pregnant after age 40. Pause to read. And this is a table that goes over some points and some things to consider in those over age 40 by trimester of pregnancy. What to do for those over age 40 in the first trimester, second trimester, third trimester, and then at delivery. Pause to read. This is a table giving examples of the risk in the pregnant population over age 40. The first is going to be higher rates of chronic disease, meaning patients over age 40 are more likely to have pre-existing medical conditions that may or may not be well controlled, and a lot of these medical conditions may need medications. That's important to consider if becoming pregnant over age 40. Number 2, less likely to achieve spontaneous conception, meaning less likely to become pregnant on your own. That's why a lot of these people in this age group will need the help of assisted reproductive technology with IVF plus or minus donor eggs. And that's due to decreasing ovarian reserve and decreasing egg quality and quantity. Higher rate of early pregnancy loss. And that is with spontaneously conceived pregnancies and even with IVF pregnancies. There is a higher rate of pregnancy loss over age 40. higher rates of stillbirth. That is true as well. Higher rates of placenta previa, higher rates of gestational diabetes, gestational hypertension, and preeclampsia that develop in the pregnancy, and then higher rates of heart attack or myocardial infarction. So if you are anticipating delaying childbearing until after age 40, please go read this article and also watch the video that I posted that's tagged in this caption. It's very important to be empowered and be knowledgeable and accept some of the realities, potential realities about pregnancy, conceiving, pregnancy, and delivery after age 40.